It's not letting me record.
You have it now.
Oh, I do? Okay.
Yes.
Okay, perfect. All right. Well, finally, let's get started. Let's see, where am I here? Welcome, everyone. It's well past the top of the hour, so we're just going to go ahead and get started. Let's see. Welcome to today's presentation. Before we get started, this session is being simultaneously interpreted into Spanish. Let's first make sure everyone's listening to and viewing your desired language. At the bottom of your screen on the Zoom toolbar, there is a globe-shaped icon. Click on the icon, select Spanish to listen to this presentation in Spanish. Likewise, you can select to view the English or Spanish representation slides by clicking on the View Options tab. At the top of your screen, a drop-down menu will appear where you can make your selection. Next slide, please. Whoop, oh, I went too far. Sorry, everyone. Looks like my computer is lagging just a bit. All right. For today's presentation, we're going to address how to manage environmental hazards, mental health, and well-being in post-hurricane recovery, a topic I'm sure some of you are dealing with right now in your communities. My name is Marta Alvarado. I am the manager of online education for MCN and the facilitator for this session. Presenting today are my colleagues, Dr. Maricel Pagan Santana, Director of Environmental and Occupational Health for MCN, and Pamela Secada Sales, Senior Program Manager for the Witness to Witness program. Dr. Santana leads and coordinates MCN projects related to climate crisis, occupational health, and emergency response. She is also the organization's lead for the Caribbean office. Excuse me. Dr. Pagan Santana provides technical assistance, training, and tool development for community health centers in Puerto Rico and the communities they serve to address disaster-related issues and health-related impacts. Dr. Pagan Santana has a master's degree in industrial hygiene and a doctorate in public health with an emphasis on environmental health from the Medical Sciences campus of the University of Puerto Rico. Pamela Secada Sales is a Peruvian immigrant with ancestral roots to the people of present-day China, Spain, and Italy. She received her master's in public health, healthcare policy, and management at the University of California in Los Angeles, and her bachelor's in anthropology and Chicano studies from California State University, Fullerton. She is currently a doctoral candidate in the Doctor of Education, Organizational Change and Leadership program at the University of Southern California. Her professional career has focused on a wide range of health issues, including substance use interventions, review of cultural competency curriculum, community health worker training, and health workforce diversity through educational equity. Next slide. This project was supported by grant number U45ES006179 from the National Institute of Environmental Health Sciences of the National Institutes of Health. The content of this presentation is solely the responsibility of the authors and does not necessarily represent the official view of the National Institutes of Health. Next slide. Just a little bit about MCN. We're a force dedicated to health justice. MCN provides clinical support and capacity building to health centers and health center staff. We are consistently developing resources and disseminating knowledge. MCN actively advocates to improve the health of migrants and immigrants on a number of issues, and MCN is involved in research and knowledge mobilization and providing innovative programs and practices. Next slide. During today's presentation, you will learn about common hazards during the recovery phase following a hurricane and how they affect workers, volunteers, and community members responding to the emergency. You'll be able to identify the effects these hazards have on the health and well-being of emergency responders, and we'll explore resources to help emergency responders better protect their health and safety during emergency management. Next slide. Just a quick look at the agenda for today. After Maricel and Pam have presented, We're going to go into some breakout rooms. One group will remain here in the main Zoom room, where we will continue with our interpretation, and we're going to just discuss mental health. And the second breakout room will be led by Maricel, and we're going to discuss occupational health, and this will take place in Spanish. And in the third breakout room, we're also going to discuss occupational health, and conversations will take place in English, and it will be led by Esther or Jessica or both. The breakout rooms will be 10 minutes, and we're just going to let you guys go to the desired room that you would like to. Next slide. All right, and with that, I'm going to let my colleague, Dr. Marisol Pagan Santana, take it away. Thank you, everyone, for joining us. Oh, excuse me, one more thing. Sorry, one last thing. Dr. Santana is going to present in Spanish, so I'm going to let our interpreters go ahead and adjust their headsets to allow that, and then we'll give them a few seconds, and then you can continue. Thank you, Dr. Santana.
Gracias, Marta, por esa introducción. Nuevamente, bienvenidos a todas y a todos. Es gusto poder verlos. Sabemos que muchos de ustedes están enfrentando un proceso de recuperación luego de los huracanes Helene y Milton, y algunos de nosotros, en mi caso yo que estoy en Puerto Rico, todavía estamos en los procesos de recuperación post huracán María, Fiona y ahora la tormenta Ernesto que recientemente pasó por Puerto Rico. Así que les acompañamos y entendemos este proceso de recuperación y esperamos que esta información les sea de utilidad. Primero quiero dejarles saber que cualquier pregunta o comentario que tengan pueden hacerlo a través del chat. Luego en los grupos de discusión podemos tener un poquito más de conversación, pero por el momento pues el chat está disponible para preguntas. También hay una cajita de preguntas y respuestas que pueden activar y escribir su pregunta ahí si les de interés. A modo de trasfondo, siempre nos gusta comenzar nuestra discusión sobre el cambio climático hablando de que esto no es solamente un evento donde ocurre alguna situación eh, de ambiental o algún huracán, sino que va un poco más allá, ¿no? Una vez nosotros tenemos estresores ambientales, como son los huracanes, el calor extremo, inundaciones, hay ciertos sistemas en sus
floods.
lugares
There
que
are
pueden hacer que
certain
la
systems
población
in place
impactada
helping
se
the
vea más
population
o menos
impacted
impactada dependiendo
to
de
help,
sus características. Así que
depending on the
siempre tomamos en
characteristics. So
consideración que a no todos nos impacta por
we
igual,
always
que estos
consider
sistemas
that not
tendrán
all of us
leyes y
will be
reglamentos
impacting us the
relacionados
same way.
a
We also
salud,
have
manejo de
related
emergencias,
laws and regulations having to do
inclusive
with
política pública
emergency
que esté
cases and the
atada
public
a
policies
la
that are linked
sostenibilidad
to
o procesos
sustainability
de
or
energías renovables
the
estén
process of
relacionados de la
renewable
manera en que nosotros podemos o
energy.
sufrimos
And that
impactos o
way
podemos
we can
recuperarnos de estos
actually
eventos.
understand
Como
if we
resultado
suffer
a
an impact,
veces,
how we
cuando
can
estos
recover
sistemas
adverse
fallan o
type of
no están
results.
adaptados a
When
la
this
población,
happens or
pues
when we
vemos
are
procesos de
not
migración y
adapted, we see that
desplazamiento.
migration and
Lamentablemente, pues muchas de las
displacement
poblaciones
processes, and very
vulnerables
unfortunately, many of
se
the
ven
vulnerable
forzadas a tener
populations
que
are
moverse del
forced
lugar, a
to
veces
move,
temporariamente, a veces
sometimes
permanentemente,
temporarily, sometimes on a
a
permanent
otros lugares.
basis,
Si
to
ven
other
esta área
places.
impactada, ocurren
The
algunas
well-being is
disrupciones que pueden
impacted,
pasar tanto en el proceso de
and
preparación
can
ante
happen
este
in the
huracán,
preparation
específicamente si
process. And
estamos
this
hablando ahora de
hurricane,
huracanes, la preparación
as
de
we have right
población,
now, to be
la
prepared in
respuesta
this hurricane
o
and
la
the
recuperación,
response and the
y
recovery,
lamentablemente pues
and
ocurren
unfortunately,
también muertes.
also death.
Esta temporada de
Doctora,
huracanes, sí, ya
if
vi
you
el
could
mensaje.
Doctor,
if you
yes,
could
I saw the
just slow
message.
down
Please
one bit.
slow down a little bit.
Sorry. Esta temporada de huracanes,
This hurricane
2024,
season,
hemos visto
2024, we
procesos
have noticed some
situaciones de
processes
huracán.
or
Vimos el
situations of
huracán Helene
hurricane.
y el
We saw the
huracán más
Elaine
reciente, y
hurricane in the
luego
east
el huracán
zone,
Milton.
and then we had Milton.
Lo que complica, ¿verdad? Estas
This
situaciones es que no
complicates
ocurren
the situation
de manera
because they do not
aislada,
occur
sino
in
que
an
tienen algunos
isolated way, but we
procesos que las
have
complican un poco más
certain
y que tienen
processes
un
making it
efecto
even
que
more
se distorsiona.
complicated and
Por
which have
ejemplo,
an
para efectos
effect
del
in
huracán
some situations, like for example in
Helene o
any,
Elena,
Eileen or Elena, hurricane, there were difficulties having to do with the risk communication for populations that at that point understood they will not be affected, or that the impact they will receive was not going to be as severe as it happened. It had to do with historic information that usually these populations are not affected, or the ongoing discussion that these areas were safe. So once we communicate this, many of the communities did not understand the risk, or they didn't communicate, and some of them decided not to move, and these floods went directly in these communities, and they suffered the damages that we are trying at this point to recover. At the same time, immediately after this process and the impact of the hurricane, we found very high temperatures combined with a loss of energy and damage to the infrastructure. And so this made it worse, of course, and put in risk some of the population depending from electricity, and also populations that will be more affected because of the temperature increase, who do not have the mechanisms to align the process.
Seguido de esas altas temperaturas, yo creo que no pasaron 1 o 2 meses antes de que estuviéramos bajo amenaza de un segundo huracán en algunas de las regiones que ya
I
habían
think
sido
not even
afectadas,
2 months happened after we were affected, in particular Florida, where there was still an accumulation of debris, and they which started the recovery process.
actividades que puedan ser
Activities that can be risky during an emergency. Part of what we want to discuss and explore with you today is to having to take into account that there is different roles in our community that might have some risk associated with that, particularly with first response workers that are working with the community, working in the health centers as volunteers. So each one of us has a role in the process of how to manage an emergency, and at the same time can turn it. So it's important in this process that we are right now, that is an aftermath, that we understand that especially today, the energy might be coming down or decrease, and some of the first response is not available anymore.
En manos de las comunidades y de las organizaciones que
So this process of recuperation is in hands of the organizations in the community. So it will be important that even though we are at a low energy level, we don't pay attention, so we can be present at the recovery process, cleaning of debris, or in case of people that are in touch with the community, to be careful in those communities where they're still in the process of recovery, so they won't have an additional risk. What risk can we see in what situations? I'm going to try to speed up a little so we can honor your time. Biological risks are some of the ones that we can come in touch with. Leptospirosis is acquired through unsafe water. This is very common in recuperation process where there is still water that is pulled in some places. So this water can cause these sorts of infections, and also in process where there have been offices, houses, infrastructure, community, places that have been dealing with flooding. So carpets, furniture, walls where they have been, they got wet, they might acquire some type of a fungal condition, especially if the conditions outside help these sort of things. When we go back to those places, or when our patients go back to those places, they can find these sorts of
¿Qué tipo de problemas de salud pueden dar estas
problems.
intervenciones?
What type of problems
También
can
vamos a ver
these
problemas
conditions
respiratorios,
cause?
algunas
Well,
reacciones
typically we
alérgicas
will see respiratory
en
problem,
el caso de la leptospirosis, pues
allergic
ya mencionamos un poco
reactions.
varios
When we talk
ejemplos
about
de síntomas que no están
leptospirosis,
relacionados a la respiración,
that in
sino solo
particular will
a
bring
la
some
sequencia
symptoms that are not
respiratoria.
related to the
De la
respiratory
misma forma,
problems.
si nosotros no llevamos a
But at the
cabo estos
same
procesos de
time, if
remoción
we don't follow the
de
removal
hongos,
process
podemos
of
tener
cleaning of
alérgicos
fungal
altos
conditions,
que den señales de que el
we can have
proceso de
conditions at
recuperación no
a
se
long
está
term
llevando a cabo
in
de
where
manera
the
completa,
recovery process is, we will
tenemos
see that recovery
que
process is
revisar
not
un poco
happening
más
completely,
fondos de recuperación como escuelas,
especially if
oficinas
funds
gubernamentales
are
y,
taking the time to
y
come back,
escuelas que sufrieron algún
especially in
tipo de daño o
schools.
infiltración
So
a
this
pesar
is
de
the
que
case
estamos
where there's a
por
school
conciencia
where
de que los mismos
that have been
estudiantes
exposed to
van
water
a
and
tratar de hacer el proceso de limpieza. Sí, se mueven
especially the
entonces a sus
people
lugares
who
de
come
trabajo o de
back to the
estudio y
school to
podríamos
try
ver
to
estos
clean
niveles
up,
de
they
exposición
can,
y
it's
tenemos
here
que
when we
trabajar
can
en
see this type of
centros de salud
exposure.
en los
And we
casos
will
de
see
asma
those in
o
our
algún
health
tipo de
center
enfermedad respiratoria.
in cases of asthma or any
De
other
esa manera,
respiratory
los procesos
condition.
de
At the
recuperación
same time, the
requieren
process of
más
recuperation
específico porque estas personas se van a
also
encargar
happen
de
when exposed to
iniciar los
chemicals.
procesos
Because these people that come in to
extracción o
clean, they are going to
extracción
be in
de
touch
algunos alimentos, pues
with the
van a
cleaning,
necesitar
especially if they're
algún
working
tipo
trying to get rid of the
y de
fungal
algunos de
conditions.
manejo de ese
So they
equipo
might
que
end up
también puede ser un
using
poco riesgoso para las
biocides.
personas que
So
están trabajando
handling these
en la limpieza
substances
y
can be a risk
recuperación
for
o
people who are
limpieza
working in
de
the
lugares
cleaning or in the cleaning process
afectados. Así
of
que
affected
importante que cuando
places.
estemos
So it
hablando
is
con
important that when we're
y
talking
voluntarios,
about
tomamos en cuenta
workers and
de
volunteers,
guías
we take
como
into
la
account
etiqueta
that
y las
biocides
instrucciones
are going to
respectivas
have
para estar
labels and
velando también
instructions on
por
how to protect
seguridad.
from them.
Los generadores también nos van a causar una exposición
Also,
adicional
generators
y es
can cause
necesario
an additional
tomar
exposure in
en
special
cuenta su
areas, especially in areas
inicial
that have not had
su
their
básicamente
electricity
exposición, que la
back.
manera de
That
de
might bring
controlarlo
that
es
sort of
evitar
exposure. The way
que
to
que
control
los
this is
generadores
to
estén encendidos
avoid
y
that
puedan ventilar y proteger a las
generators
personas vulnerables al aire
are not ventilated, and
del
especially
proceso de
protect people
generación
who
de
are
energía.
vulnerable
Pero
to
sin
these
falta de duda, pues puede verse un aumento en las
generators.
personas
And we also need to know that we
con
can also see
respiratorias
this
según
in
haya
people with
aumento de
respiratory
frecuencia.
conditions according to if there's electricity or
Otro
not.
riesgo físico, un riesgo
Another
físico
physical
que
risk
vamos
or a
a
physical
enfrentar
risk
en el
that
caso
we
de
can
recuperación de
see
emergencias pueden
in the
ser varias,
case of
incluyendo caídas o
emergency
vuelos, pero nos
recovery.
vamos a enfocar en
There can be
exposición o
falls, there
exposición al
can be
calor.
heats, and we
Puede
will
ser
focus now on
caída, respiración,
radiation. But so you
entrando
have to
sistemas
know that
externos,
falls can happen, especially in people who
escaleras
are
o
repairing
tratando de
roof.
subirse a algunos lugares.
So be careful when you're using
Caídas
ladders or climbing
internas
up because you can suffer from a
con
fall.
un impacto mayor o
But
áreas que impactan a la población más en
in
general,
areas that
tenemos
impact
la exposición
general
a calor
population,
extremo
we
o
will
temperaturas
see extreme heat exposure.
nosotros le queremos resaltar es que la exposición a
And that's what we
lugares
wanted
de
to
temperaturas
highlight.
altas pueden verse un poco más común.
This
Por
exposure
ejemplo,
can happen in where there is high
en el
temperatures,
caso
and
de
it will
Florida,
happen more commonly
vemos
in there. In case of Florida,
temperaturas altas durante el verano,
when
pues a
we
lo mejor
see high
no
temperatures
consideramos el
during the
calor como un
summer,
riesgo, pero
we might
hay
not
que luego de un
consider the
huracán,
heat as a
la
risk,
dinámica
but
entre la humedad
you
relativa
have to know that
y la
the
temperatura
dynamic that
puede
exists
causar entonces
between
que las temperaturas
humidity and high
relativas,
rises
como
of
percepción de
temperature
calor o
can
percepción del calor,
cause that
sea mayor
heat that we are
en días
sensing.
como
It's
son o
it's
en tiempos que
more than
estamos
usual,
en la
and if
calle
we combine
o en
those
las
risks, the
afueras en
time
la
that when
ciudad
we're
tratando de
on the
hacer limpieza de
streets, in
escombros
the
o ayudar
outdoors,
a comunidades
cleaning
afectadas,
debris, or trying
a
to make
veces
it
pues
to affected
nos
communities.
afecta mucho más,
So sometimes
especialmente
we
lo
will be
vemos
affected
en los
much
servicios en
more.
Puerto
We'll
Rico con
especially see here in Puerto
proveedores de
Rico
salud o equipo de
with
ayuntamientos
health
municipales que
providers
hacen
or
visitas al hogar durante las
outreach
emergencias
teams that
y
are
no toma en
visiting
cuenta
places during
tiempo de
emergency,
descanso,
and they don't
tomar agua y
consider
luego entonces
resting
sufren
times, drinking
enfermedades relacionadas
water,
al calor.
and then
Lo
this
mismo
can
puede pasar
turn
con
into the
voluntarios o
conditions
a
related
personas
to
de la
heat. The
comunidad que
same
estén
thing can
trabajando
happen
en
to
este proceso de
volunteer
recuperación.
community people who are working in this recovery process.
Tenemos cerca de 1.300 muertes por
We
año
have
debido
around
a
1,300 deaths each
esto no es
year
algo nuevo.
to heat in the United
Debemos tener
States.
en
So
cuenta
this is not
todas las
something new. We
temporadas de
have to
huracanes
consider
en todos
this.
los veranos
Each
y
hurricane season
posiblemente pueda ser el riesgo
and
número uno
possibly
de los procesos
can
de
be the
recuperación
number
cuando
one
estamos
risk
hablando de
in
que
the recovery
afecta a todas las
process
poblaciones, ¿no? Y que
when we're talking that it can affect any type of a population, and there is populations more
Es importante
in
que hay
risk of
unos
being
factores que
affected.
pueden afectar el
It's
calor que
important that
sentimos,
there's factors
sensibilidad a
that can
humedad, pero
affect the
también
heat that we
ausencia
feel,
de viento,
humidity,
días consecutivos de calor. En el caso
lack
de
of
Puerto Rico estamos llevando
wind,
más de
heat
40
waves. In
días
Puerto
con
Rico,
temperaturas
we
sobre
have
90, que es totalmente
been
atípico, así
over
que
90
tener olas
degrees
de
for
calor
over a
o
40-day
días de calor que
period
puede afectarnos.
or
Nosotros
consecutive
tenemos
heat
ese proceso
days,
de
and that can
descanso,
affect us
especialmente
because
si estamos conectados en
there's no rest
niños, que son las
times,
comunidades que hemos
especially
visto nosotros mismos
if we
afectados por estos
live in
eventos, y si
communities
no
that have been
hay
affected by
energía
these
eléctrica o
events,
si tenemos
and also with the
alguna
absence
otros
of
riesgos,
energy or electricity,
temperaturas
that
altas durante
brings
la
another
noche
risk.
y zonas urbanas que podrían tal vez
High
conectarse.
temperatures during the night and urban areas
¿Quiénes son
can
las personas
also
más
heat up
vulnerables?
more.
Todas las
Who
personas
are
que
the
trabajen
most
en el exterior, en
vulnerable?
este caso
That will
personas
be
que estén
people who work in
respondiendo
the
a la
outdoors or
emergencia o en
people
el proceso de
responding to an
recuperación, personas
emergency
que
and
usan
recovery
vehículos bajos,
process,
niños,
low
mujeres embarazadas,
socioeconomical
pacientes con
status,
enfermedades
children,
crónicas y
pregnant
migrantes.
women,
En cuanto a
and
los
patients with
reportes, deben
chronic
hacer reportes
disease.
también al
When we talk about patients, I have to
gobierno
note
con
out
documentos
that
relacionados
there's some
a
medications
diabetes,
that are
hipertensión
related to
o
diabetes,
salud conductual que
hypertension,
tienen una
or conductual
interacción
health,
con el
and those have
calor.
an
Es
interaction with
importante que
heat.
si
So
las
it is
temperaturas están
important
altas y hay
that
ausencia de energía
if there's
eléctrica,
a high temperature
cuidemos a
and
estos pacientes
lack
y
of
debemos
electricity,
apoyarlos en cómo manejar
consider those patients and
dosis
support in how to
almacenamiento de
handle
medicamentos para que no se vean
the
afectados.
storage of medications so they won't be affected.
El calor también va a afectar condiciones
The heat
existentes
will
como
also
diabetes, enfermedad
affect
cardíaca,
existing or
dislexia,
worsening
asma
existing
y
conditions,
otros problemas de
diabetes,
salud
heart
mental, como
disease,
ya
dementia,
mencionamos,
asthma, and
y
other
otros
mental
afectados.
conditions, just like we said with the
¿Cómo podemos
medication
apoyar
prescribed as
a
well.
estos
How
trabajadores?
can we
¿Cómo
support these
nuestra organización
workers?
puede apoyar a las personas que
How
están
can our
tratando
organization
de apoyar
support
procesos de
people who
recuperación?
are trying to
Es
support
importante
this
que podamos
recovery
hacer
process?
una
It is
identificación,
important if we can
seguimiento y monitoreo en el
identify,
centro de salud
screen,
para
and
brindar servicios de
monitor
salud
at the
de
health
manera
center or to
rápida. Esto
offer
puede
health
ayudarnos
services
a
quickly. That
identificar
can help
áreas o
us to
comunidades
identify
particulares de alto
areas or
riesgo,
communities
llevar a
that
cabo
are in
educación
risk.
a través de alcance comunitario,
Education through
específicamente
community
derechos y
outreach in a
responsabilidades de los
specific
empleados,
rights
en
and
contra de que
responsibilities of
empleados que
employees,
llegan
and take
como
into
parte del
consideration
proceso de
that many of them
recuperación
are
a
coming
lugares de nuestra comunidad y tal
to
vez
help
no
out or support
conocen
the recovery process,
siglos
and
de
they don't know their
identificación de estos
rights.
riesgos.
Assist them in identifying
Evidencia
this
sus planes
risk
de emergencia.
and help them
Temporada
with their
huracanera
emergency
2020 no ha
plans.
culminado, así que es
Unfortunately,
importante en este momento,
this is
que aunque
not
estamos en el proceso de
over. So it is
recuperarnos de
important
una
that
emergencia,
even at this
sí
time,
demos una mirada
when we are in the process
al
of
futuro,
recovering
¿verdad? Tenemos
for
emergencias tal
emergencies,
vez
we
que no
take a look
funcionaron como
at
pensamos,
those
otras funcionaron
emergency plans
y
that
hay que
might not
aspirar
be
a poder
working
trabajar mejor
and
o
try to
inclusive si hay
assist to
partes de ese
work
plan que ya
better, even
no
if there are
existen o
parts of that
fueron
plan
descartadas durante esta
that are
emergencia,
not
ayudar
existent.
ese proceso de reposición. De igual manera, podemos hacer
At the same
programas
time,
o
we
buscar
can build
apoyo
up
para capacitar a
programs or look
trabajadores
for support
de
to
este proceso
protect
de
the worker
recuperación,
that
protección
are
respiratoria,
part of this
protección
recovery
auditiva y la distribución de equipos de
process, like
protección.
respiratory protection, hearing protection, and personal protective equipment.
Tenemos varias herramientas
We
que
have
vamos a
many
estar
tools
presentando en nuestro grupo
that
de
we
discusión,
were presenting in our
incluyendo una
discussion
guía para
groups,
clínicos para
including a
manejar
guide
información sobre estrés a calor,
to handle and give
una hoja
information
informativa de cómo
for
utilizar
heat,
protección
an informative
respiratoria en
sheet in
diferentes
how to
idiomas
use
y una
respiratory
hoja
protection
informativa
in
de
different
cómo usar
languages, and an
ventilación en
informative
nuestros espacios
letter
para
in how to
evitar
improve
ya sea por
ventilations
enfermedades
to
infecciosas
avoid
o por
spread out of
nuestra salud,
infection
por
conditions
ambiente o aire que esté
or
contaminado.
bad effects in health for
Y con esto,
contaminated
pues,
air.
concluyo mi parte de la
And with
presentación y
that,
paso
I end
el
up my part of
micrófono
the
a Pam.
presentation and I pass it to Pam.
Hi, good afternoon. Thank you, Marisol.
Let's go ahead and let the interpreter switch their audio back. So we're gonna Pam will present her section in English, and translation will go into Spanish. Thank you.
All right, thanks everyone. Thank you to the interpreters. My name is Pamela Segada Sales. I use she, her pronouns, and I'll be presenting on managing mental health and well-being post-hurricane recovery. Next slide, please. So, thank you. So as we transition from one topic to another, I just want to take a minute to pause and invite you all to join me in a quick breathing exercise. We had a little bit of technical difficulties at the beginning, so I just want to make sure that we all shake off that tension and center ourselves again with this quick exercise. So I invite you to sit comfortably in your chair. Again, if you notice any tension in your shoulders or in your arms, you can go ahead and shake that off. You can place your hands on your legs, on your desk if you have it, on your side, whatever feels comfortable for you. And focusing on our breath, we'll just take 3 deep breaths together, breathing in through our nose and then out through our mouth. Okay, let's go ahead and get started. Breathe in, breathe out, breathe in, breathe out. And one more time, breathe in and breathe out. Thank you all for joining me on that. Next slide, please. So I want to start with this image here on the screen of these 3 emergency responders assisting this injured person. We can notice that the responders are well equipped. They have their protective gear, they have equipment. It looks like they're tending to the wounds of this victim, maybe helping her with her bleeding. But what I also want you to note is that these responders are not just providing this physical help for this person, they're also witnessing a traumatic situation. So I know, and what we also don't know is if this is the first rescue of the day for these 3 responders. Is it their 10th rescue of the day? Is it their 20th? Are they veteran responders or is this their first rescue? And so I can imagine, and we can all imagine that with each rescue these responders are experiencing, it's a new witnessing experience. And so what I want to emphasize here is that there isn't just one witnessing position, but there's 4. And I'll go ahead and talk about that in the next slide. So this is a model that was developed by Dr. Kata Weingarten. She is the founder of the Witness to Witness program here at MCN. And MCN uses this model in most of our mental health and well-being programs. And the model again shows that there's just not one witness position, but there's 4. And I think everyone on this webinar has heard or seen the devastations caused by Hurricane Helene and Hurricane Milton. Maybe some of you have been directly impacted or know someone who has been directly impacted. I know I'm in Los Angeles here, and what I've seen and heard on TV and social media has been pretty disturbing. And so most of us might find ourselves on the left side of this model where we're aware of what is happening. And if if we're on the front lines, we're aware of what is happening and we're also aware of what needs to be done. But what we hear from most healthcare workers, emergency responders, is that during times of crisis, is that they're in an aware position, but they feel disempowered in relation of what to do. And this can be because they don't have resources, either internal resources or external resources. And we saw this a lot at the beginning of COVID, where nurses were being pulled to work on the front lines, to work in the ICU. But in the beginning, we know they weren't properly, they didn't have the proper training and they weren't properly equipped with PPE. And so when we introduce this model to healthcare workers, most of them will relate to the yellow square. And some of the words people use to describe being in that yellow square are stressed, they feel exhausted, they're overwhelmed. So the purpose of the work that we do here at W2W is to introduce frameworks and offer tools to move up to that green square. And we know that if folks don't have the resources to move up to the green square, again, they can be either external or internal resources, they'll start to move over to the right side of the square. And that's what we don't want, is we don't want folks to be so overwhelmed, so stressed that they start to numb out or check out of the situation as a form of taking care of themselves. I know I've been guilty of this. I'm sure some other folks on the call have been guilty of just kind of not wanting to deal with things. And maybe, yes, that could be an effective strategy for that hour, or, okay, maybe that day, but it's not a long-term solution. The only long-term strategy for when we're constantly overexposed to stories of or situations of trauma, hardship, violation, or violence is to move up into that green square. And so the entire focus of W2W is to give folks tools to move up, not over. And I want to be clear that what I don't mean is that we should aim to be in that green square all the time, because that's unrealistic, because nobody is resilient all of the time. What we want to aim for are moments of effectiveness where we are aware and empowered, and therefore we feel effective and competent to act at that moment. Next slide. So moving up into that green square requires an understanding of what is happening in our bodies when we are faced with challenging situations. And what is happening in our bodies is stress. So what is stress? Stress is a natural psychological and physical response to situations that we perceive to be challenging or threatening. Next slide. And it's important to know that not all stress is bad, and there are two types of stress. Acute stress are situations that most of us find ourselves in. For example, preparing for a medical exam, taking care of a sick patient, um, trying to start a Zoom webinar and the interpretation function isn't working. So all of these situations are acute stressful situations. We can notice that our heart starts to race a little faster, our hands get clammy, and these are all natural signs. And what's important to remember is that our bodies are designed to respond to stress, and they're also designed to get over the stress. Now, chronic stress, on the other hand, is a result of stress that has built up from repeated exposure to stressful situations, and this can negatively impact your health, your work, and your relationships. Next slide. And I mentioned that stress is a response to challenging or threatening situations. And in order for that stress response to begin, there has to be a stressor. And stressors are events, situations, or stimuli that causes the stress response. And here are some examples of stressors. Today, we talked a lot about environmental stressors, but there are also health-related, workplace-related stressors, and financial stressors. And what I want to mention here is that a lot of these stressors are deeply intertwined with systemic racism and oppression, which is why we see disproportionate impacts on marginalized communities. Next slide. And so, as I mentioned earlier, our bodies are designed to respond to stress, and it'll do so automatically. And so when our bodies are responding to stress, it's giving us signals or cues. And here are some examples of those signals. This is not a complete list, but what I do want to mention here is that typically our bodies will send us the same types of signals or sensations. For example, I know when I get upset or I'm faced with a situation that I perceive as challenging, my heart starts to race, I get tingly, my hands get sweaty. We also get psychological experiences with feelings of shame or sadness. And the point that I want to make here is that, again, our bodies are pretty reliable with sending us these cues or these signals. And it's important that we're aware of them, to acknowledge them in order for us to manage it. Next slide. And so there are two components to stress management, managing the stress. It's the stressor and then the stress response. And we want to address both the stressor and the stress response. So I want to give you a hypothetical situation. Let's say you are a medical receptionist at a community health center. You are checking in a person for their appointment. The person looks like he's stressed, and he says something that is disrespectful and hurtful and offensive to you. In that situation, the stressor is the person and what the person said. And the stress response is the reaction, what is happening in your body in that situation. So let's go back to the example. So let's say you were able to talk to this patient and tell them, connect with them and tell them, you know what you said wasn't right. It wasn't okay. The person acknowledges, immediately apologizes, says he had a bad day. So in this situation, you're able to address the comment that the person said, and you were able to resolve the stressor. But now we need to address the stress in the body. And in a couple of slides, I'll share some practices on how we can manage the stress in the body. Next slide. Oh, so the stress continuum is a model that was originally developed for use in the Marine Corps, but has been adapted for use in healthcare. And we can see in this model that it's broken up into 4 parts, 4 colors. And the model gives us an easy way to visualize your response to stress and also your coworker's response to stress. And it not only gives us a visual interpretation, but it also helps to reduce stigma around talking about stress. And the idea of the stress continuum is that everyone will react to stress, but the stress response lands on a spectrum, on a continuum, and that is based on how well we're prepared and our resilience. So what's important here to highlight is that during a stress response, an individual can switch and move between colors pretty quickly. And the goal of the stress continuum is to catch folks before they get to the red zone, where we start to see more persistent and significant impairment like anxiety, depression, PTSD. Next slide. I just want to take a break right here and ask you all how many of you have heard of the stress response? The stress continuum. And you can just drop it in the chat. I just want to get an idea of who's heard of this, and is it being used in your health center or in your work organization? Never. Okay. Well, so at the end, I'll go ahead and provide some more resources on the stress continuum for those who are here and are interested. Next slide. So this is a picture of Audre Lorde. She was a Black feminist civil rights activist, writer, and poet. And this quote you see here is from her essay, A Burst of Light. And I'll quote, I have come to believe that caring for myself is not self-indulgent, it's self-preservation. And I included this image and this quote because I think it's crucial to recognize that self-care has political and social roots. Wasn't born out of the trends that we see nowadays, where it's, all face masks and candles and aromatherapy, but it came out of necessity, especially for Black and Brown communities that had to navigate, the harsh realities of what racism and systemic oppression is. In a society that threatens your very existence, your well-being, preserving one's well-being was seen as a radical act. So for activists, self-care was anything that gives you a way to reconnect to yourself, reconnect to your body. So it builds resilience to care for yourself and then to care for your community. And that's the idea of self-care that we see here at W2W that I want to share today, that self-care isn't about just yourself. It's actually how we take care of our collective well-being. Next slide. So what is self-care? So self-care is caring for yourself in all of your roles with compassionate, not just action, but also thought. It's anything that makes us feel better. It's something that happens in your personal life. It's not something that just happens in your personal life or in your free time. And it's not about a quick fix, but it's about forming habits, daily habits that build resilience. Next slide. And caring for oneself might be a simple concept, seem like a simple concept, but it's not always easy. So some things to remember is that you don't need to earn self-care. It isn't something that we get because we worked really hard or because we gave to others, we volunteered. It's something that it's a human right. And self-care is not leisure, it's not a luxury thing that we do. You don't have to pay and you don't have to spend any money on it. It doesn't have to take a lot of time. And the last thing is that you're worth it. Self-care is a human right, and every human being is born worthy of compassion, of kindness, of love from yourself and as well as from others. Next slide, please. So self-care starts with self-compassion. And this is a concept that was developed by Dr. Kristen Neff. She is a psychologist and researcher at the University of Texas in Austin. And it involves three components. Self-compassion is being kind and understanding to ourselves when we're having a hard time. It's remembering our common humanity. And self-compassion requires taking a balanced, mindful approach to our suffering. And it's treating yourself like you would treat a friend in a time of need. Next slide. Grounding is another practice, and it involves compassionately paying attention to yourself with the intention of centering yourself. It's not about forcing yourself into a state of calm. And grounding can be done with some quick, easy steps. You can step outside, you can sit on the grass or stand with your feet barefoot touching the ground. You can close your eyes if you want. And here is just to focus on the sensation you feel beneath you. And it's important to not expect any certain outcome because grounding is allowing space for presence and reconnecting with yourself. And when people are grounded, they feel more connected, they're aware and centered, they have more clarity, they can make better decisions, and uh, they feel more efficient, and they feel more healthy emotionally and resilient. Next slide. Breathwork is another powerful tool for reconnecting, and many Indigenous and non-Western cultures emphasize the importance of the breath as a source of life. So here are some examples of breathwork. You can do box breathing or cyclic sighing. And again, breathwork is used as a relaxation technique that helps us slow our breathing so it can reset and restore to its natural rhythm. Next slide. Joy snacking is a term that was coined by Dr. Richard Sima, who is a neuroscientist and columnist at the Washington Post. And the idea of joy snacking is that you can experience sustained joy by appreciating even the small occurrences of joy that we encounter throughout the day. It's intentionally making the time and making the effort to notice these little everyday mundane experiences. And the idea is that as you practice noticing these simple everyday experiences, in the long run, it'll be easier for you to notice them, and it'll create more sustainable joy. And so an example that joy snacking that I want to give is at the start of the pandemic, I rescued a 3-month-old little pit bull puppy, and I've had him ever since, and you might hear him barking in the background. And every single morning when I am getting ready to feed him, after he eats his breakfast, he waits patiently for his after breakfast morning treat. And every single time I go to reach for that treat, he does this funny little dance that just cracks me up. It sets my mood for the day. It helps me set my intentions for the day. And those are the things that joy snacking is noticing those everyday little occurrences that just bring a smile to your face and just cultivate joy. Next slide. And the final self-care practice that I want to mention is rest, and it's a vital self-care practice. And drawing from Tricia Hershey's book, Rest is Resistance, where she emphasizes that rest is not just about personal rejuvenation, but it's a radical tool for reclaiming our humanity and well-being. And while Hershey's message was primarily aims to support BIPOC communities to resist the systemic pressures that perpetuate exhaustion, especially among marginalized communities, the principles and the concepts, I think, are universal, especially for healthcare workers, community workers, volunteers, and emergency responders who are on the front lines during disasters. And we can go even deeper into this practice by understanding that rest is different than sleep. And Dr. Sandra Dalton-Smith, who is a board-certified physician, she also wrote the book Sacred Rest. And in this book, she talks about the 7 types of rest that sometimes are lacking in our lives. And, to truly restore our bodies and our minds, we need to understand where our rest deficits are so that we can learn to replenish them. Next slide. And so these are some resources, original resources that were created by the WTW program, Dr. Kata Weingarten. Helping the Helpers is a comic book that takes the experience of a community health worker talking to one of her coworkers. It's available in English and in Spanish. Next slide. And this is another resources that Dr. Kata Weingarten wrote, understanding the different types of stress disorders. By understanding the different stress disorders, we can properly react and address them. Next slide. And these are some of the resources, the references that I mentioned today. Thank you.
Thank you, Pam. And with that, I just want to remind everyone to please complete the evaluation at the end of this presentation. I'm hoping that one of my colleagues can stick the evaluation links into the chat, please. And while we're doing that, let's go to the next slide. Oh shoot, I went one too far. Really quick, please leave if you have time, leave us a review on Great Nonprofits. We value your opinions. Please share your stories. We appreciate anything that you all can write in support of MCN. And really quickly, just a reminder to stay connected to MCN by accessing our resources, getting updates from the field, or attending one of our many online educational offerings. You can also follow us on any of our social media platforms. And with that, I'm going to go back to the evaluation QR code, if you will, please, on the Spanish deck. And if anybody has questions, because we had technical difficulties at the beginning, we're not going to have time to break out into our breakout rooms, but we do have time to answer any questions, any comments that you may have. So please feel free to raise your hand or stick it in the chat or the Q&A. And I don't know if Doctora, you want to say anything before we sign off, or Pam, you have anything to say? Go for it.
Solamente que los recursos que repasamos
Only
por
that
encima de salud
the
ocupacional
resources of occupational health are available in our webpage, and also the comics related to health, and that can be very useful.
Si tienen alguna
If
petición
you have
especial o alguna necesidad
any
más
special
apremiante que quieran que
need
nosotros
or
atendamos,
other
sea
more
cuestión de
urgent need
referiros
that you want us to see, you are
también a
welcome
través de
to
nuestra página web y
write
nosotros
us
con mucho gusto
using
les
our
atendemos.
webpage, and it will be a pleasure to take care of that.
And just a reminder that I will be sending everybody a follow-up email later today that's going to have the links to the recordings and the evaluations for the session, including a PDF, the PDFs of both English and Spanish PowerPoints. And in those PDFs, any links that we have linked in there are live, and they will take you directly to where you would like to go. And I'm also going to share with you all a resource sheet that has many of MCN's resources around occupational health, disaster management, and mental health and well-being. I don't see that we have any questions that came in.
No, Marta, lo que sí veo es una petición de compartir información de contacto,
One
así que si
thing I
puedes,
see is a
cuando
request to
comuniques
share our
la
contact
presentación, incluir
info. So when
los correos
you
electrónicos
can,
tanto mío como de
please,
Pam, te lo
if
agradecería.
you can include an email and Pam's email, I will be thankful for that.
Yes, I can include that in the follow-up email. I will include Pam and Doctora Pagan Santana's email. So in case any of you have questions, you can contact them directly. And I still don't see any questions that have come in. So I just want to quickly apologize for the little technical mishap we had earlier today. It happens, and I appreciate that you guys hung in there and stuck with us. And with that, I just want to thank Doctora Maricel Pagan Santana, Pam Secada Steos, my wonderful team that is here helping me with the Spanish recording and the Spanish slides. Thank you all, Esther, Nicole, Jessica, Roxana. Sorry if I forgot anyone. And then a huge thanks to our interpreters. Thanks for helping us with our language justice efforts. And with that, I'll let you all go to respect everyone's time. Have a great rest of your day. Be on the lookout for that follow-up email that I'll be sending later today. Thank you, everyone. Have a great rest of your day.